A single injection. For many dogs with arthritis, it looks like a miracle. Within weeks, they move easier. They run again. They seem years younger. But inside the body, something powerful has just been switched off. A molecule that nerves rely on to communicate pain, and sometimes to survive. Today I'm looking at what really happens inside a dog after the first injection of Librela and inside cats treated with Solensia. To understand it, I need to talk about a molecule called nerve growth factor, because blocking it changes the way the nervous system works. Both Librela and Solensia are modern biologic drugs designed to treat pain caused by osteoarthritis. Instead of acting like traditional anti-inflammatory drugs, they work in a completely different way. They don't reduce inflammation directly. They block the signal that tells the brain something hurts. And that signal starts with NGF nerve growth factor, the role of NGF in the body. NGF is one of the most important signaling molecules in the nervous system. It was originally discovered because of its role in nerve development. In the body, NGF helps support neuron survival, regulate nerve repair, guide nerve growth, amplify pain signals. When tissue is injured, when tissue is damaged, especially joints affected by arthritis, the body releases large amounts of NGF. NGF then binds to receptors on sensory nerve fibers, especially the tricha receptor. This binding makes those nerves more sensitive to pain. It's part of the body's warning system. Pain tells an animal, something is wrong. Protect this joint. What Librela and Solensia actually do. Both Librela and Solensia are monoclonal antibodies. Think of them like highly specialized proteins designed to lock onto a single target. In this case, that target is NGF. After injection, the antibody circulates through the bloodstream. When it encounters NGF molecules, it binds to them. Once NGF is bound by the antibody, it can no longer attach to nerve receptors, which means the pain signal is dramatically reduced. For animals with severe arthritis, this can produce remarkable improvements in mobility, but at a devastating cost. What happens after the first injection? Let's walk through what happens biologically. Hours after injection, the antibody enters circulation. Unlike many drugs, monoclonal antibodies stay mainly in the bloodstream and surrounding tissues. They begin searching for their target, NGF. Days after injection, NGF molecules begin to be neutralized. Pain signaling pathways in inflamed joints become less active. The nervous system essentially receives fewer danger signals from the joints. Weeks after injection, many animals show noticeable improvement. Dogs that previously struggled to walk may begin moving freely again, at the cost of slowly destroying their joints from within. Cats that avoided jumping may start climbing and playing. This dramatic change is why these drugs have gained popularity. They offer the illusion of healing, whilst destroying their joints, organs, and overall health. The complex role of pain. Pain is unpleasant, but biologically, it exists for a reason. Pain forces the body to protect damaged tissue. When pain signals are reduced significantly, animals may start using joints that are already structurally damaged. In some human studies of NGF-blocking drugs, researchers observed cases of rapidly progressive joint damage in certain patients. This led scientists to examine whether extremely effective pain suppression could sometimes allow joints to be overused. That research is part of why NGF blockers underwent extensive study. and failed in human trials. What scientists are still studying. Veterinary clinical trials of Librela and Solensia showed strong pain relief benefits. They saw only what they wanted, ignored the fact that the same mechanisms failed in human trials, yet got it passed for use on our pets in the new formula called Librela and Solensia. However, like any newer class of drugs, monitoring continues. Reported adverse events have included things like death, lethargy, mobility changes, neurological signs, skin reactions, liver damage, kidney damage, ataxia, anemia, behavioral changes, and so much more. Regulatory agencies track these reports and claim these side effects are rare or very rare. These patterns and risk factors are very real. They are not rare or very rare, and because monoclonal antibodies stay active in the body for weeks, their effects cannot be instantly reversed, and there is no antidote to these drugs. The big question. NGF blockers clearly reduce pain, but scientists are still studying the long-term effects of repeatedly suppressing a molecule that plays multiple roles in nerve biology. Questions researchers continue to investigate include how long-term NGF suppression affects joint health, which animals respond best, whether some animals may be more sensitive to the drug. As with many medical innovations, the science continues to evolve. For many pet owners, drugs like Librela and Solensia provide meaningful relief from the pain of osteoarthritis. But they only believe this because they are told these drugs have no side effects. These drugs are the best drugs for their pets, but understanding how they work is important because these medications don't just treat symptoms. They change how the nervous system processes pain. And whenever we change a biological signal as fundamental as nerve growth factor, it's worth asking questions. Pet owners deserve clear information so they can make the best decisions for the animals they love.